Hello everyone, Dr. Cox here, an oculoplastic specialist based in Boulder, Colorado. Let's talk about the term blepharoplasty. It certainly has a lot of movement in the past 10 years. It increases every year globally as a procedure that is done in all age ranges. So I want to take the time to talk about what it means. If you looked up the definition of a blepharoplasty, it would say removal of excess eyelid skin, which can occur during an upper or lower blepharoplasty, but it doesn't necessarily end there. In this particular video, I'll be talking about lower blepharoplasties. It's a super common consultation that I see every single week, multiple times a week. So when patients come in and they request lower eyelid blepharoplasty consult, they're really talking about, hey, how do I make this area look brighter, less tired, whatever it may be. And then we move on. I educate patients on anatomy, what's happening in my anatomical structure, so that I may understand the treatment options better. And inevitably, we always get into, yes, a blepharoplasty conversation if you're a candidate, but it doesn't end there. We're talking about skin resurfacing or regeneration. We're talking about cheek or mid-face recontouring, lifting it or revolumizing it. And so sometimes it just doesn't end at the eyelid. And why? Because the lower eyelid and the cheek are a functional unit. It's not like the lower eyelid's over here and the cheek is over here and they just never communicate. Absolutely not. They flow quite literally into one another. So it makes sense that we're talking about these structures that are right next to one another. And the things that we see that patients commonly articulate, what they notice over time, it could be fat bags, it could be loose skin, it could be dark circles. That's kind of where they describe it, but then we talk about the anatomy, the unit, and most commonly, in my blepharoplasties, you may have fat sculpting, you may have skin regeneration or skin resurfacing, and also we may talk about the midface. Are we revolumizing, recontouring the midface? Are we lifting the midface? And it's because many things happen in the area from your lashes to about the middle part of your cheek. So blepharoplasty, we may call it that, but it actually has much more nuance in it. And I think the more that you understand that, the more the treatment options make sense to you, because this is an educational moment. It's not just about going from A to Z and I want to be seen for this, I want to look better, and I'll skip over everything in between and then I get there. No, you should understand, and part of my job is to help you understand anatomy, science. We bridge that gap through education to the treatment, and then it's a very successful outcome when you understand all these things. So blepharoplasty, yes, it's part of lower eyelid rejuvenation, but it certainly doesn't end there. And lastly, I'd just like to say, everyone, depending on the age they present, to their anatomy, genetics, habits, has a different something going on in this area. And so it may be a combination of all the little things that I just discussed. So hopefully this is helpful. Blepharoplasty, yeah and no. A little bit of everything. Thank you.